We have the different classifications that we go about as when we are classifying or categorizing the condition which is known as amblyopia, on the other hand, which is in a layman terminology, which is known as a lazy eye. We can categorize these conditions which are causing this amblyopic condition as the congenital causes, and then we have the acquired causes on the other hand. Over here, we're talking about the deprivation amblyopia. Deprivation amblyopia is usually caused by the congenital causes. Now, what can be the different sorts of congenital causes which are resulting in a deprivation kind of an amblyopic condition in the child? It can be the congenital cataract, which is basically causing an obstruction in the light pathways and then again causing in return a blurred image formation on the retina. One of the reasons can be the congenital ptosis, which is basically caused by the nerve damage that is basically resulting in the drooping of the eyelid. Again, the poor focused image or the sharp image formation on the retina is obstructed over here whenever we have this congenital ptosis over here. So these are the basic two causes which are again resulting in the deprivation kind of an amblyopic condition which we're talking about over here. On the other hand, in contrast, we have the other kind of acquired conditions which are resulting in the amblyopia of the child. It can be the refractive errors, which are basically the unequal refractive errors, refractive indices in both of the eyes, known as an anisometropic condition. Or on the other hand, it can be the squinting of the eyes that is observed in the child, and one of the causative factors over here is the strabismus that is causing a poor focused image on the retina of the child over here. When we are focusing on these facts, it can be the visual effects that we can talk about over here. What kind of the visual field defects that would be observed in a child of an amblyopia? In simpler words, we can say that the child is suffering from the blurring of the vision. The visual acuity is basically reduced. The visual fields would not be affected in this case particularly. There are different treatment modalities, and we'll be discussing the treatment of specifically deprivation amblyopia over here. Obviously, it would be the correction of the error. Again, if it is a ptosis, we'd be treating the ptosis surgically if needed. If it is severe enough, we'd be treating that surgically. And on the other hand, if it is cataract, we can again treat it surgically. So usually the treatment modalities that are related to the deprivation amblyopia, deprivation amblyopia is basically related to the surgical treatment over here. Then on the other hand, we have the pathogenesis that is related to the deprivation amblyopia over here. So one should know that what is the pathogenesis that is related to this kind of deprivation amblyopia when we're talking about it. As we've already talked about it, the underlying pathogenesis would be the blurring of the vision that is caused by, again, the multiple factors on the underlying. And then on the other hand, when we talk about it, these blurred images would be causing the visual acuity to reduce in the affected eye. So this is the causative factors over here when we talk about the deprivation amblyopia. With the passage of time, it's again very important to treat the underlying causes as well as the amblyopia itself. If it is the cause is the weakened muscles, the weakened extraocular muscles, they can be strengthened out by the wearing of the specs. There are a lot of exercises that can be inculcated over here. On the other hand, we have the patchy eye treatment. So this is the complete discussion of the deprivation amblyopia that we'll encounter over here. The visual effects would be a reduced visual acuity on one hand. We'd observe the reduced contrast sensitivity, a reduced vernier activity as well as there would be a stereopsis or the stereo acuity that is observed in these children, the effects are cortical in nature, and the problems will persist even when amblyogenic factor is treated. So even if we use the perfect corrective lenses, a perfect correction in the child, there would not be 100% result observed in the child. So this is a very definitive thing for the diagnosis of the amblyopic conditions. On the other hand, the child would be suffering from a decreased visual acuity, the child would be suffering from a reduced contrast sensitivity, as well as there would be a reduced vernier acuity that is observed in the children as well over here. The treatment would obviously depend upon the first step of treatment is to correct the amblyogenic factors. If it is the ptosis has to be addressed. If it is the cataract, we have to address the cataract. The surgery is the option in both of these cases. The strabismic amblyopia, strabismus is treated first. It can be a surgical correction as well as it can be the exercises that are inculcated, and even the wearing of the specs can sometimes treat the strabismus in itself. Muscle surgery is the one of the option over here, and some patients have the accommodative esotropia due to hyperopia. So it's again very important to know this fact that sometimes the child is suffering from a very high refractive index, and this very high refractive index is it itself resulting in the strabismus in the child. So when you correct this very high strabismic index, this refractive index in the child, in itself it would correct the strabismus, and there will be no need for surgery in this particular case of refractive index that is causing the strabismus in itself. So this is the pathogenesis over here. As you can see, that this is a normal eye in which we have the correct focusing or sharp focusing on the retina. On the other hand, we have an eye with a refractive error which is not focusing in a proper way. There is a poor focus on one eye. So it's one of the reasons that we have discussed over here. It can be the poor refractive index can be one of the causes of the formation of amblyopia in the child. Amblyopia basically causes suppression of the blurred image. The brain rejects the blurred image basically, and then the confusion results from the superimposition of the two dissimilar images. So the occipital lobe would not interpret all of these changes in a particular way, and these pathological causes would basically result in the superimposition of the two dissimilar images on the retina. Squinting in the left eye is observed, and if untreated, the permanent loss of vision in the left eye can result. So making the awareness in the parents is again very important, that they should notice any strabismic changes. Even if the child cannot complain, obviously the infant cannot complain of a poor visual acuity, but the parents can observe that there is some sort of a problem in the child. He is not responding to anything that they're calling out the names, or if they're waving out, and if the child is not responding in a proper manner, that would be a detection of visual acuity in the children. So this is one of the ways that we can observe that there's some sort of a decrease in the visual acuity in the infants. On the other hand, we have the deprivation amblyopia, and what are the causative factors towards this deprivation amblyopia? It can be a lot of congenital conditions. For example, it can be the cataract formation, which is again of the congenital causes. It can be the maternal infections. On the other hand, we have a lot of maternal drug interactions which can result in the corneal, cataract formation in the lens. And then we have the ptosis, which is again of a congenital type. So all of these types or the causative factors which can result in the media opacity in the eyes of the infant can be one of the causes for the deprivation amblyopia in the child. This form of amblyopia is the least common but most damaging and difficult to treat in the children. Acuity can decrease for almost 20 to 200 or even worse than that. So if left untreated, it can result even in the complete blindness or in the children. The incidence in children is younger than 6 years is very common. The dense congenital cataract that occupy the central 3 millimeters or more than lens capable of causing the severe amblyopia in the children. The similar lens opacities acquired after 6 years are generally less harmful because the cortical binocular development of the cells has been achieved in these children. But if it is less than 6 years that we're talking about, this cortical development of the cells is hindered out due to the less formation of the acquired images or sharp images in the children. So this is one of the factors that we have to consider over here. The causative factors would include the small polar cataracts and the lamellar cataracts on the other hand. It may cause mild to moderate amblyopia in the children as well. So on the other hand, we have the occlusion amblyopia, which is a form of deprivation caused by the excessive therapeutic patching. So the therapeutic patching in itself can result from the occlusion amblyopia in the child. So one should be aware of the fact that what sort of a patching is required in a particular case of amblyopia. The diagnosis, again, the characteristics of the vision alone cannot be used to reliably differentiate amblyopia from the other forms of the visual loss. The crowding phenomena, if we have multiple images forming on the retina, that is again going to be due to the crowding phenomena that is observed over here. The characteristic of the optic nerve disease but occasionally appear to be present with amblyopia over here. So this is the particular diagnosis that has to be made, in which basically there is a decreased visual acuity. On the other hand, we can define this condition as there is a decreased visual acuity, and we have ruled out the retinal pathologies as well as we have ruled out the ocular pathologies over here. The binocular fixation pattern, when we talk about it, it is a test for estimating the relative level of vision in the child. This test is quite sensitive for detecting amblyopia, but results can be falsely positive in the children. So it's sometimes quite confusing when you're determining the visual acuity in the children. Usually you have to perform the automated tests on the children rather than a manual method to detect the visual acuity problems in the children. Usually the children would not give you the history of a blurred vision, if there is some sort of a correction even that can be made by the maximum corrective errors or by the application of different corrective measures. So it's sometimes quite tricky to deal with these children, and this is one of the methods that is devised known as the binocular fixation method, that is especially for the children. The backhand or the disadvantages to it are the false positives that we usually encounter over here. It shows a strong preference over here, and when the vision is equal or nearly equal in two eyes, only when we can perform this binocular fixation test. So if the child is suffering from anisometropia, that is basically the difference in the refractive index in both of the eyes, then we cannot perform this binocular fixation test, and this is one of the limitation that we have to observe with this kind of the testing phenomena. So in this section particularly, we just focus on the deprivation amblyopia. Knowing this condition is again very important. What are the different causative factors to it? What is the underlying pathogenesis towards the development of the decrease in the visual acuity and the further decrease in the visual acuity? And then what are the different treatment modalities by which we can treat this deprivation amblyopia? So that is the end of this section. Thank you for watching sqadia.com.